Hello everyone, this is Dr. Alberto, streaming from Rehealth here in Cancun. Good morning, good evening, or good night, depending on the time that you're watching this video. Today we're going to discuss about stem cell therapy, in this case for a particular application, which is autoimmune conditions. Now, we gotta mention this, and I'm very keen on talking about this topic specifically because these are the conditions that tend to improve the most with the use of stem cell applications. So I want to discuss about who we are, what is an actual definition, basic definition of an autoimmune condition, what are the current treatment alternatives for those autoimmune conditions from medical perspective, from biomedical perspective, or alternative medicine perspective, as well as the use of stem cells. What is the definition of an allogenic stem cell? Because there are different situations right there that are very confusing, especially because stem cell, as a definition, it's used very loosely without an actual true definition, and that can lead to some form of misunderstanding. I want to continue with how stem cells are going to work, how the stem cells actually work, or the mechanism of action of the stem cells, specifically speaking about autoimmune conditions. And we're going to wrap it up with a little bit of the therapeutic potentials of the stem cells for autoimmune diseases. Now, first of all, what is regenerative medicine? Regenerative medicine, it's a new term, it's a new era of medicine. It's a branch of translational medicine, or the actual application of tissue engineering, molecular biology, as well as cell-based products, like in our case, that has a main purpose to actually help replacing, regenerating, healing different human tissues. Now, what is the main goal of regenerative medicine? Restore or establish a new normal function of whatever tissue may be affected. Now, about us, this is very important because there are some facts that need to be addressed. Now, according to the FDA does not allow any form of cell-based therapy performed systemically. Now, this is the reason why we are based here in Cancun, specifically because the FDA does not allow any clinic, any hospital to provide the stem cell therapy the way we do it. Now, it's true, our group, our owners, the main corporate is based in the US, and that's where the preclinical research takes place. However, in order for us to be compliant, to be legal, and to operate in the best way and more transparent way, the treatment center is based right here in Cancun. Now, our main mission is to apply our current expertise, our current experience, everything that we have gathered throughout the time of researching, using or applying cell-based therapies as a scientific as well as a viable alternative for a different array of conditions, mostly autoimmune conditions when we're talking about adults. Who we are, basically, Advanced Biomedicine is the owner of both Ortiz Clinic, which is our clinic aimed to treat pediatric conditions, and Rehealth is our clinic aimed to treat adult patients. Now, about our processes and affiliations. Our processes, what we have the potential to offer right here. We have our own bone marrow bank. Right here, we have a picture of our actual laboratory in-house. We also have our own private mesenchymal stem cell bank harvested from umbilical cord tissue. We do have our own license to practice regenerative medicine, legal license right here. Therefore, without this license, there is not an opportunity for a clinic to provide this type of treatments here in Mexico. Now, about certifications and how we process our products. Basically, we have to comply with CGTP and CGMP regulations. This basically stands for Good Tissue Practice and Good Manufacturer Practice Compliances. And this is under the ISCT regulations. ISCT stands for International Stem Cell Therapy or Therapeutic Regulations. And everything is done under and inside our laboratory, which is built under ISO 7 laboratory. ISO 7 stands pretty much for the level of cleanliness. Is it too much to have this type of laboratory for what we do? Sure it is. It's not needed to have such equipment. However, we do have it because the main objective is for us to expand and start increasing our knowledge regarding stem cell therapies and cell-based therapies. Now, regarding affiliations, we are currently working with Gristem, which is a new company over there in the US, which is currently providing stem cells for a couple of hospitals because Gristem has had accepted a protocol to treat COVID-19 or severe COVID-19 patients. So just keep in mind, if the stem cells can actually help a patient who is under severe COVID conditions, such as being intubated, rather in the hospital in ICU, and these patients have been pretty much cured or taken out of ICU in a couple of days. Just imagine what can happen with the application of stem cells for autoimmune conditions. Now, that is just a quick introduction of who we are and what we do and what we have here in our laboratories. So let's focus on what this lecture is going to be about, which is an autoimmune condition. Now, just to describe what an autoimmune condition is, we have to understand this from two different perspectives, the medical perspective as well as the perspective of a patient. Medically speaking, there are a bunch of markers, there are a bunch of reasons in which your immune system is going to attack different organs. However, per definition, there are some patients that do not have very clear what's going on. They just understand that they have problems with their bones, they have problems with the central nervous system, they have problems with their blood. However, they do not know how or why this is taking place. Basically, an autoimmune condition, it's an abnormal response aimed towards one particular target. What type of abnormal response? Pretty much your own immune system driven or controlled or receiving instructions or the wrong type of instructions by a group of cells known as T cells are going to target one organ of your body and start attacking it because they consider it as the enemy. That's pretty much the definition of an autoimmune condition. Now, we have to state that for every type of autoimmune conditions, there are no cure. So there is no cure. There are different medical treatments, biomedical treatments, or like we said, regenerative medicine treatments. However, it's not a cure. We have to understand that. And statistically speaking, just in the US, about 7% of the population is dealing with any form of autoimmune condition. This is not counting pediatric patients, okay? Now, what areas, what organs may be affected by an autoimmune condition? Pretty much everything that you can think of, whether if it's your central nervous system, could be your lungs, could be the thyroid, could be your gastrointestinal tract, could be your bones, could be your skin, could be your blood. So the array or the diversity of condition is pretty much endless. It's about 100 to 110 different known autoimmune conditions up to date, and pretty much whatever part of your body, any part of your body can be a target of your own immune system. Now, what are the causes of an autoimmune condition? Well, there is something that I like to call a triad that consists on, as a potential cause, genetics, which is an area that unfortunately we cannot do too much about, idiopathic, which is a fancy word of we do not know why, and environmental, which is a part in which there are different variables or foreign environmental variables that may causing an insult towards your immune system. The more you poke, the more you affect, the more you stress that immune system, there will be a moment in which it's going to overreact or hyperreact against your body. So if you notice here in the image, there is one part that says endogenous factors. Endogenous factors are the areas in which idiopathic can actually fit. Now, it's very important for you to understand that pretty much anything or everything that can overstress your immune system can be a factor. Something as ridiculous as just aging or puberty or pregnancy or even hormones can be a problem. Something as simple as stress, which is stated in here as an emotional vulnerability. So that's something that can be a potential trigger of an autoimmune response. Different levels, different intensity, different level of affection, sure. However, it's still a factor. Same thing as with environmental ones, such as pollution, heavy metals, toxins, environmental toxins, dirty diets, etc., etc. So potential causes, you have to consider these three factors. Genetics, there is not too much to change because we can't at the moment. However, the other two type of factors we can do something about. And this is a situation that leads me to exactly the following slide. What are the actual treatment or available treatment alternatives? We have the three most common ones, which are the regular or traditional medical applications, in which they consist on using medications such as anti-inflammatory medication like Ali, for example, just to control a little bit some of the symptoms, some steroids, some biologics. The most common ones or the traditional ones are Enbrel, Humira, and the fairly new ones known as DMARDs, which stands for disease-modifying anti-rheumatic drugs. Basically, this is a type of drug that has been in current use for treating rheumatoid arthritis, for example. Now, what is the main problem with this? Pretty much the side effects. 90% of our patients that have been here aiming to treat some form of an autoimmune condition, they give up on the medication specifically because the side effects that they experience are not exactly a walk in the park. So number one reason why a patient with an autoimmune condition gives up on medication is not because they are not improving, it's because they cannot tolerate the actual side effects of some of these medications. I'm not saying that that they don't work. They do work, they do help. However, the actual cost versus the benefit for some patients is not worth it. Now, about complementary medicine or medicine from the functional aspect, this is the factor or the area in which most patients are trying to work something against the idiopathic aspect, as I said it in here. The environmental factors as well as the endogenous factors. What they are trying to do, focusing on diet, trying to eliminate as much as possible any potential pro-inflammatory factors, focusing on wellness, trying to improve or to achieve some level of relaxation, reducing stress levels. Same thing with mindfulness. Yeah, they are trying to control as much as possible these variables that they do have some form of control in their own hands. And then we have another alternative, which in this case is the biomedical one, in which stem cell falls as in this type of category. There are some other ones, however, I want to focus on stem cell therapy because that's the nature of today's topic. Now, speaking of stem cells, this is something that I want to emphasize and to be very specific because this is one of the areas in which there is the highest amount of confusion and misunderstanding. What is an actual stem cell? According to the International Society of Cell Therapeutics or Cell Therapy, an actual stem cell, a mesenchymal stem cell, when it's grown in a laboratory or when it's under expansion process, the stem cell, an actual stem cell, it's a type of cell that is plastic adherent. Actually, that's one of the ways that you can identify them visually because it's a stem cell, it's a cell that tends to stick to plastic. That's it. Now, what other factors you should take into consideration when you go to a clinic and they claim that they have a stem cell treatments? Ask for the expression of the markers. Ask for the certificates of what markers are being expressed or not being expressed by the product that you are going to receive. An actual true 100% driven mesenchymal stem cell should express three markers at least: CD105, CD73, CD90. These markers should be positive. And on the other hand, there should be some other markers that should not be there. For example, at least under 5%, in some cases under 2% of these markers should be expressed. CD45, CD34, they should not express HLA marker, which it's a surface marker that it's associated with histocompatibility. Okay, if whatever product any clinic is offering you do not have this type of certificate, it's possible that they are not providing a stem cell product, okay? It's maybe a cell-derived product, but not an actual stem cell, which is very important because different products may yield different results and may also compromise whatever other clinics may be doing specifically as an actual treatment. Now, what are the potential uses of an actual stem cell? They have the potential to differentiate, heal, and promote the repair of different tissues that are related to the mesodermal lineage, such as muscle, bone, cartilage, tendons, myelin sheath, blood. So there are different areas in which the stem cells have different applications and can improve the performance and the viability, the life, and the shape and the form of different, for example, articulations or even the immune system. Now that we have clarified what an actual stem cell is, we can actually focus on the sources and types of stem cells. Now, as you may know, you have heard about autologous versus allogenic. Autologous is a type of stem cell that is coming from your own body and is going to be used on yourself only. And allogenic is a type of a stem cell that is coming from a donor and is going to be used in a patient that it's a different source where the stem cells are coming from. Now, autologous usually here relies, or in this category falls, adipose tissue cells or bone marrow collected cells. In some cases, cord blood, specifically speaking, when there is a family that is banking the cord blood and then used in the future for whatever application they may be looking for, but specifically for that particular patient. Now, allogenic, this is where the umbilical cord tissue or umbilical cord blood cells can be used in different patients. Now, what is important, I'm going to focus today only in umbilical cord tissue cells, or in other words, allogenic or donated umbilical cord tissue cells, which are the ones that we use and the ones that we have studied the most. Now, let's focus on how stem cells work, what's the mechanism of action of the stem cells. Now, we have to understand one thing. Let's pretend that there are two different scenarios. The perfect scenario in which that environment it's perfectly functioning, no issues whatsoever, let's say the healthiest of the human beings, no conditions, no nothing. And then we have another scenario in which there is some form of stress, okay? Under the perfect scenario, what the stem cells are going to do, it's pretty much regular blood pressure, maintaining homeostasis, and this homeostasis is going to be related or linked to preserving the perfect environment for whatever cell, whatever tissue to perform and or to act, specifically cells, okay? Now, when we are talking about stress, whatever the stress factor may be involved, for example, such as an autoimmune condition, the cells are going to respond according to the environment where they are being infused or the environment where they are arriving to work, okay? Now, if we have an overly active immune system, the main mechanism of action of the stem cell is going to try to regulate this hyperreactivity, this negative environment, in order for the rest of the cells to be performing in the best way possible. Why is this? Let's focus on the stem cells as this tiny analogy. I like to think that the stem cells are like a SWAT team, okay, in which the main objective of this team or this particular very specific type of cells is to, in the presence of any hostile environment, in the presence of any hostile event, the main objective is to always preserve the rest of the cells that are not compromised, okay? Pretty much they are going to protect everything that is not compromised. How is this done? They are going to modulate the environment. So imagine like there is a riot. You are not going to destroy or to attack the rioters. What you're going to try to do is to improve the environment in order for the rioters to start calming down and then becoming or being receptive to the social environment, which is pretty much what we have in this image. You have one cell, the yellow cell, that it's exactly the same family as the orange and the other yellow cell. However, in this tiny cartoon, they are actually attacking their own frame. That is exactly what's happening. However, the stem cells are going to fall into this category and say, hey, this guy is our friend, we should not destroy it. Okay, that's pretty much how it works. If you want it in a more scientific way, what is going to happen? Stem cells are going to release something known as trophic effects that are going to act as anti-scarring effects or avoiding tissue not to die. They are going to promote cell functionality, avoiding the programmed cell death of different cells, obviously. They can actually potentiate the formation of blood vessels, because blood vessels are equal to blood flow, and blood flow equals to oxygen, and they are going to promote the formation and the preservation of different cells. And that's on one side. That's promoting or facilitating the tools for the immunomodulatory effects, or in other words, the perfect environment to happen. So you are looking, as it says right here, to establish the best possible microenvironment for whatever tissue to perform and to develop. That's pretty much how the stem cells work in any way, shape, or form for almost any type of condition. If we translate this into autoimmunity, the trophic effects are going to be, for example, in multiple sclerosis patients, to protect the myelin, to protect the nerves, to reduce the potential of affecting the central nervous system, promoting blood vessels in order to push more oxygen into different areas. More oxygen means more muscular function. And on the other hand, they are going to modulate the immune system in order for your own immune system not to attack constantly that central nervous system, and it's going to transpire into maybe better functionality, less pain, less discomfort, and in other words, the possibilities for relapses not to end, okay? Maybe taking the evolution or the progression of the condition to a halt. That could be a possibility for the stem cells, right? Now, why allogenic? Well, pretty much because we're talking about a healthy, certified source of cells. The quality of the cells can be very much under control. You are pretty much handpicking the best group of cells that can be useful for that particular patient. In adults, when you collect stem cells from the adipose tissue, or you collect stem cells from the bone marrow, just by aging, our production of cells tends to decrease both in quality as well as in quantity. So it's very likely that in an autoimmune patient, the quality or the quantity of the cells that you may harvest to treat that patient may be compromised, yielding less better results or less positive results. I'm not saying that they're not going to be of use. However, the actual therapeutic effects may be compromised somehow. Now, also another reason why mesenchymal stem cells have demonstrated the best clinical success in various autoimmune conditions. So, and this is mostly because they have greater anti-inflammatory properties. So, something that it's important to mention, telomerase activity. Everybody's right now is talking about telomeres and how to preserve the telomere length and whatnot. However, if we are talking about right here about an actual healthy, very young, useful source of stem cells, these stem cells have very long telomeres as well as very high telomerase activity. The higher the telomerase activity, the better the response as a cell in terms of functionality. Now, speaking of some of the reasons why we do encourage our patients to have a stem cell therapy from a allogenic source, we have here two perfect examples. Using bone marrow-derived stem cells from multiple sclerosis patients, it works. However, the function may be suppressed if you compare it to a healthy source. In other words, if you're going to use stem cells for an autoimmune condition, we do suggest to use a source of a stem cell that is healthy and not using an autologous source for that patient. Once again, not saying that it's not working, however, the therapeutic function may be limited somehow. Same thing happens in this experiment of autoimmune encephalitis, encephalomyelitis model, in which they use adipose-derived stem cells. However, there was no therapeutic efficacy. That's the reason why for this type of conditions, we do suggest the use of allogenic stem cells. Now, what are the actual therapeutic potentials of the stem cells? I'm showing here a couple of examples of stem cell application for rheumatoid arthritis in a group of patients, which, if I'm not wrong, it's around 120, 124 different patients. Not a single one expressed any adverse reactions. A second one, the pro-inflammatory markers such as tumor necrosis factor alpha as well as interleukin number 6 was decreased significantly. The reduction of the regulation, of the T cells increased significantly. Once again, let's keep in mind that the T cells are the ones that get crazy. The T cells are the ones that send this negative behavior activity that is going to attack your organs by your immune system. So these are the ones that must be under control, and these are the ones that you can actually trace how they are working with the use of stem cells. And in some cases, some of the patients actually express or refer to some form of remission of the condition. Now, if we talk about lupus, for example, which is another alternative, in a study of 40 patients, same thing, no adverse events. I want to focus on this particular thing. The use of stem cells is very, very, very safe. Worst horrible case scenario, if we are talking about properly harvested stem cell, worst case scenario is that the patient remains exactly the same. The use of stem cells is very, very safe as long as it's a true stem cell, very, very, very cautiously driven and cautiously prepared. Okay. Now, about this particular example, about 13 of the patients expressed major response and 11 patients expressed some form of response. The difference why some patients may improve more than other patients is basically because there is no patient that is exactly the same as another. There are different factors that must be taken in consideration that we mentioned before, which are genetics, environmental, as well as endogenous factors. There are some patients that can improve tremendously well with one treatment, and there are some patients that may improve tremendously well but with 3 treatments. Okay. In a way to actually measure or quantify how a patient is improving, there are different scores, such as one known as SLEDAI, which it's a standardized score for some patients with lupus that express or help you measure where they are positioned. So this score went down with the use of stem cells. There are some patients that with lupus that starts to express difficulties with the kidneys, also known as nephritis. So some of these patients improve in this area as well. And one of the areas that you can actually trace with a fairly simple blood work or blood test is the anti-nuclear antibodies, also known as ANA antibodies. These are the ones that you can easily track and trace after a stem cell treatment, in which you are going to notice that they will decrease. Okay. Again, let's focus. It's not a cure. However, if you're bringing down all of this, you are going to achieve exactly this, the potential improvements of whatever autoimmune condition you are referring to. Let's pay attention to this. These are just some of the basic, let's say, areas of improvement regarding mobility, pain control, disinflammation, functionality, going back to work, going back to your hobbies, less flare-ups, functionality, keeping up with your kids, practicing sports, being reinserted to your everyday activities. That's phenomenal. It's just a matter for you to understand what are the areas in which you may improve depending on the condition that you're struggling with. For example, if you have Crohn's disease, maybe you're not going to be eating the same way or the same stuff that you were eating 10 or 20 years ago. However, the fact that you are not experiencing pain anymore, the fact that you're not experiencing cramps, the fact that you don't have diarrhea anymore, it's a huge plus for those patients in which they can go outside to a restaurant with confidence without the fear of feeling that they are going to throw up or that they are going to experience some form of symptom. Same thing with multiple sclerosis patients, in which some patients are bounded to a wheelchair. Maybe it's not that they are going to run a marathon, however, they can gradually gain some form of mobility up to the point that maybe they are going to move from a wheelchair, maybe perhaps to the use of a walker, or maybe responding a lot better to some form of physical therapy, or maybe with rheumatoid arthritis patients that are struggling with a lot of pain And after the use of stem cells, they are not only getting some form of mobility, but the pain is going away without the use of any biologics that are causing a lot of side effects. So it's just a matter for everybody to understand. I am struggling with X, Y, Z type of symptom. However, I'm improving in A, B, C, D, E, and F type of areas. So it's a matter to evaluate your individual needs in order for us to try to help you understand where are the areas in which you may respond the better. Okay, now to sum up, why allogenic? Why do we suggest this? Pretty much younger cells transpire into easiest and the best expansion capacities, best telomere and telomerase activities, and this transpires into the best immune modulatory capacity. Remember, always remember, these type of cells are going to respond better in terms of immune modulation than an autologous source. Now, this leads me to the second point. A diseased stem cell source is not going to work as effective as a healthy source. Again, I'm not saying that your own cells are not working. I am saying that your cells are compromised, okay? And finally, they have proven not only safety, but they have also proven an actual clinical positive demonstration against different autoimmune conditions. And finally, I would like to thank you for paying attention to this lecture, to taking the time to watching this quick video, to taking the time and to thank you for the trust in our information. If there is any question, please don't hesitate to send us a message to DRO@Advanced Biomedicine. Feel free to jump quickly to our webpage. If you have a question and informations are free. We can have as many phone conversations. We can have a Zoom meeting. We can have a FaceTime meeting to address your questions, your concerns, to evaluate your case. And if after that you choose to move forward with the treatment, fantastic. If not, that's fine as well. The main idea here is for you to make a natural, informed, and educated decisions. With the main intention to address and sort out every single piece of concern that you may have popping in your mind. So once again, thank you so much for your time. See you next time.